You know, we've talked with Dr. Sandy Spencer about pains in the butt, which is basically with sciatica. But what about the rest of your body? You say, well, Jim, I've got pain in my neck, I got pain in my back, I got pain down my arm. What do I do about that? What do they do about that, Dr. Spencer?
Hey, Jim,
Good
welcome,
to see you as always.
welcome.
Thank you.
Today I want to talk about the role that the disc in your spine can play on your health. How do I get problems in my disc? You know, how do they occur? What happens? And what can I do to fix it? What kind of symptoms show up when I have disc problems and so forth? So let's go to this little model right here.
Alrighty.
All right. So this is just a cutout view of your spine. Okay. These are the bones right here. This is where your spinal cord lives. And these are your spinal nerves right here, these little yellow things. So what happens when a person will develop a disc problem is this outer part right here will get a little crack in it right there. And some of the center part will start to ooze out and put pressure on these nerves right here. It's a very painful situation. And this can occur anywhere along your spine that you have a disc. So you can have symptoms such as headaches, numbness and tingling down the arms and hands, lower back pain, sciatic nerve pain. All of that can be affected by disc problems. So a lot of people want to know, well, how did I get this? What happened to make me this way? Is it just because of old age? And it's not.
Please don't say that.
No. So I'm going to take this other little model, Jim,
Okay.
and show you that the spine is supposed to be able to move freely like that. And the disc will get its nutrition through this motion that you have through your everyday movements. Something can happen and make your spine lock up. And when it does, this material, this water content will start to shrink out, and then you go to lift something and pow. It'll come out, press on the nerve, just like right here. So when that happens, we have some treatments in our office that can actually heal the disc and pull this material non-surgically, without drugs, without shots, without surgery, back toward the center so that the nerve can heal. What happens when the nerve heals? You feel better.
No more pain.
No more pain. The nerves are healed. There's no more need to take all these pills. There's no more need to get all these shots. There's no more need to be on pain management. So
Is herniation, disc herniation sometimes, can that contribute to migraines?
absolutely, it
Okay.
can, yes. So migraine headaches can be caused by herniations in the upper part of your neck. You can get numbness and tingling down your arms or hands. A lot of times, let's just take, I take care of a lot of patients with neuropathy. So neuropathy is where the nerves die in your feet and you're not getting good circulation, and you may or may not even be diabetic. But a lot of people have pressure on the nerves in their back and they're not getting good circulation to these nerves. Well, the nerves go all the way down to the feet. So when you have pressure at the garden hose where it's coming out of the spigot, when you go to squeeze it down at the end, does it come out?
No.
No, it doesn't. So the problem has to be, in neuropathy, a lot of times the problem has to be fixed here at the spine and here at the feet, because there's a cause and there's an effect. Neuropathy is very progressive disease, and the sooner we can get on treating it and patients stop masking it with medications that are not working, the better results we get with treating it.
So as you said, the disc herniation that you show here can basically affect us throughout our entire body, like our heads, our arms, down our back, our legs, our hips. If you don't get it corrected, then you could get to the point where you can't walk.
It can affect, and so I'm going to challenge all of our viewers to do something.
Okay.
After they watch this segment. Go to the grocery store and watch people walk. Walk through the grocery store, see how mobile people are, and ask yourself, what am I doing for my health and my spine and my nervous system to make sure that I keep walking like a normal person, that I can keep moving, that I can keep shopping, that I can keep living without pain in my spine or losing my balance or being able to feel my feet. Because health is not just a gift. You have to work toward your health.
Sure you do.
You have to work toward your health. So if telling your body to shut up with medication all day is your idea of working for health,
No.
you're gonna be one of those people you see in the grocery store that are having problems getting around because eventually, you've told your body to shut up long enough that this degeneration is advancing.
What causes things like this?
It's a loss of this pumping action in the disc. So the spine can lock up.
I mean, can you be like have an accident or something that causes this? Or
Accidents, repetitive motions,
not exercising?
not
or?
exercise, sitting more. I have more and more patients that sit for 4 to 6 hours. They're not doing heavy labor, but their disc becomes inactive because they're sitting, they're not mobilizing. So if you have a sedentary job, I see most of my disc problems for people that are sedentary rather than active.
I'll find myself sitting at my desk at work for a couple of hours or something like that, knowing that I'm sitting in a good position, kind of slumped over, on the see the screen, and I'll sit up and my back is just like, ow, that hurts.
So that's probably because you've lost this gliding motion, because with the gliding motion, you should be able to sit up, sit down with that normal gliding motion. And that's one of the things we check with your hands-on spinal exam. So a lot of times patients come in with their MRI and I look at that and everything. I start doing their exam and they say, you're the first doctor that's ever touched me. I've been to 5 doctors for my back and none of them have ever touched me.
Really?
Yeah, they just look at their MRI. And you know what I tell them? I say, you're a person, you deserve a hands-on exam. You know, because the MRI, yeah, it gives some good information, but this is, I think, why we have so many failed surgeries. The surgeon just goes straight for what's on the MRI. They don't correlate it clinically to what's happening with the patient, which is key. You must do that, or you're going to go in and fix something that's not really causing problems. Studies showed that 50% of our population have this right now with no symptoms.
Wow.
Yeah, so maybe it's the one above that, maybe it's the one below that. And if you try to fix them all, the patient is permanently immobilized with all these rods and screws, and they didn't know what they were signing up for that.
Just the whole idea of having rods and screws through your back or any part just is horrifying.
Yes, and I wish I had a picture to show you of that.
No,
I'm going to bring it next time because I have plenty of them. And yes, there is a time and place.
And I think it would be good for people to see them. I really do.
Yeah, and I can help a lot of people who have had surgery with other things, but you know, I see a lot of failed surgical cases.
Wow. Dr. Sonia Spencer, thank you so much as always for this great information. If you're having some problems with mobility or whatever, your back, your neck, constant pain, you could be having something like this herniated disc. So what you need to do, call and set up an appointment. She's located on Pass Road in Gulfport, across from Pass Road Elementary, just to the east of Washington Avenue in Gulfport. Dr. Spencer, thank you so much.
Thanks, Jim.